Okay, now we're going to talk about stress loading for complex regional pain syndrome. Stress loading is a type of intervention that's not super evidence-based. There's not a lot of evidence that suggests that it's for sure working, but that doesn't mean that you can't get benefit out of it. And it also doesn't mean that it has to be your sole intervention. So you're going to have other things that you're doing to help this patient, but this is also something that you can incorporate into your treatment to get some benefits out of. So the general idea of stress loading is people with CRPS, often because the pain is so severe and so constant, they have a high risk of having disuse of that extremity, which, disuse could lead to atrophy, which is a whole other problem. So one of the benefits of stress loading is that at least you are getting some movement in through that extremity, whether it be through the act of brushing or weight bearing, as we'll kind of get into. So we'll start with describing the first part of stress loading, which is the brushing. And this is just like maybe you could use this to wash a car, something like that. But the idea is that you get them into quadrupeds. So I'm actually going to get onto the table and say that my affected arm is my right arm. So you get them like this, ideally with the shoulder over the affected arm. And in this position, you're really putting a lot of pressure and weight into the surface. So you're just going back and forth. And the idea is also that you're staying constant in the amount of pressure that you're exerting. And if the person is in so much pain that that's not really possible for them to be doing this brushing movement, they can also switch it to the other arm and just kind of use that arm in like a weight bearing. Because even though they're not getting as much movement, they are still exerting some type of muscle movement by just the simple act of weight bearing. So that's another option. Also, if the person is not able to get into this position because maybe that's not accessible, or maybe they have problems with their lower extremity, that's not an option, you can always switch to a tabletop. You're not going to exert as much pressure because you're not in that quadruped position, but it is still effective in moving those muscles and just getting that input in through those muscles that are probably going through disuse. So that is the scrubbing portion of the stress loading. The second part is carrying. So you would have whatever it is, we have a bucket here and we put a weight inside, but you might also have them use a briefcase or a purse, something that just has significant weight to it. And again, my left is the affected one, so I'm just going to kind of walk back and forth with the weighted thing that I'm carrying. And with both of these, the general protocol says to start with like 3 to 5 minutes of the brushing and then 3 to 5 minutes of the carrying, with the idea that you'll increase the frequency and the duration of each of those as the protocol progresses. But that's kind of the general place that we start with.